An abdominal hernia really represents a protrusion of one of the intra-abdominal organs, typically the bowel, through the abdominal wall. And that leads to the common patient complaint of physical impairment from the important activities that they used to be able to do that they can no longer accomplish because of the hernia. At the Penn Hernia Center, our goal is to get these patients back to doing what they want to do as quickly and as safely as possible. We have a group of experienced interdisciplinary surgeons together under one roof that focus on treating patients who have hernias of all different types. The treatment options for abdominal hernias typically focus on surgical interventions, getting the tissues back together, and typically reinforcing these repairs with a piece of mesh to support the fascial healing and the closure. Abdominal incisional hernias are oftentimes very difficult to treat and lead to high rates of recurrence. So really it's critically important to get it right the first time. One example of how we do things differently is that we really try to make sure that the first repair is going to be the last repair for the patient. And this means spending extra time at the first operation to repair the muscles using state-of-the-art approaches to make sure that the hernia doesn't come back. Post-operatively, we have care pathways to really accelerate recovery and to make sure that our hernia patients get the resources they need after surgery. Having physical therapy evaluate these patients as soon as possible and to managing their pain as best as we can. This oftentimes leads to early discharges, getting them back to the things that they want to do, both at home and at work.